Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Female infertility. Introduction. Infertility is a term healthcare providers use if a woman is unable to get or stay pregnant. After treatment for infertility, 2/3 of couples are then able to have children. Infertility is a common problem. About 1/3 of the time, infertility is because of a problem with the woman. 1/3 of the time it is a problem with the man. Sometimes no cause can be found. This program will help you understand female infertility. It covers causes and risk factors, as well as diagnosis and treatment options. The reproductive system. This section reviews the female reproductive system. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the vagina. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. The ovaries are glands with two main functions: the production of specialized hormones such as estrogen and progesterone, ovulation, which is the release of eggs needed for reproduction. Estrogen and progesterone prepare the inner lining of the uterus in case a pregnancy takes place. They also regulate when eggs are released. When an egg is released, it goes down the fallopian tube and into the uterus, where it may or may not be fertilized by a sperm. If fertilized, the egg becomes implanted in the uterus. The fetus grows in the uterus. If not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body through the cervix and the vagina during the menstrual period. The menstrual cycle is usually 28 days. The levels of estrogen and progesterone increase before and after ovulation. If the egg is not fertilized, hormone levels decrease and menstruation begins. Estrogen and progesterone are only two of the many hormones that control the menstrual cycle. In addition to regulating the menstrual cycle, estrogen keeps bones healthy. It may also affect cholesterol levels, keep skin and arteries more elastic, and help memory. Female infertility. Pregnancy is the result of a process that has many steps. Infertility can happen if there are problems with any one of those steps. Infertility is usually used to describe a woman who has not been able to get pregnant after at least 1 year of trying. If the woman is 35 or older, she is considered infertile if she hasn't been able to get pregnant after 6 months. A woman may also be infertile if she can get pregnant but is unable to stay pregnant. Both women and men can have medical problems that cause infertility. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. There are many possible causes for female infertility. It can be caused by physical problems, hormone problems, and lifestyle or environmental factors. Most cases of infertility in women are caused by problems with ovulation. Without ovulation, there are no eggs to be fertilized. Irregular menstrual periods may be a sign that a woman is not ovulating normally. Polycystic ovary syndrome, or PCOS, is a problem that affects egg production. The ovaries may not release an egg regularly or may not release a healthy egg. PCOS is the most common cause of female infertility. Premature ovarian failure can cause problems with ovulation. This is when a woman's ovaries stop working before she is 40 years old. It is sometimes called primary ovarian insufficiency, or POI. Less common causes of female fertility problems include blocked fallopian tubes due to pelvic inflammatory disease, endometriosis, or surgery for an ectopic pregnancy, physical problems with the uterus, uterine fibroids. Risk factors. Many things can change a woman's ability to have a baby. The following section discusses some factors that increase a woman's risk of infertility. Age may affect a woman's ability to have a baby. About 1/3 of women over 35 have fertility problems. As a woman ages, her chances for pregnancy decrease because her ovaries release fewer eggs. The number of eggs decreases. The eggs become less healthy. Age also makes a woman more likely to have health problems that affect fertility. A woman over age 35 is more likely to have a miscarriage. Other risk factors for female infertility include athletic training, being overweight or underweight, alcohol abuse, health problems that cause hormonal changes such as PCOS and POI. Other risk factors for female infertility include unhealthy diet, sexually transmitted infections, smoking, stress. When to seek medical advice. A woman's chances of having a baby decrease every year after the age of 30. Most experts suggest waiting at least 1 year before seeing a healthcare provider about infertility. Women 35 or older should see their healthcare provider after 6 months of trying. Some health problems increase the risk of infertility. Women should talk to their healthcare provider if they have endometriosis, irregular periods or no menstrual periods, more than one miscarriage, pelvic inflammatory disease, painful periods. It is a good idea for women to talk to a healthcare provider before trying to get pregnant. He or she can help you get your body ready for a healthy baby and can also answer questions about fertility and give tips for conceiving. Tests and diagnosis. There are tests that may tell you if you have fertility problems. Your healthcare provider will perform a physical exam. He or she will also ask for both partners' health and sexual histories. The first step in testing infertility in women is finding out if she is ovulating each month. There are a few ways to do this. A woman may track her ovulation at home. Ovulation can also be checked with medical tests. A woman can track her ovulation at home by writing down changes in her morning body temperature for several months, writing down how her cervical mucus looks for several months, using a home ovulation test kit. A healthcare provider will explain how to do these activities. Your healthcare provider can also check ovulation with blood tests. They can also do an ultrasound of your ovaries. In some cases, ovulation is found to be normal. If ovulation is normal, there are other fertility tests available. A laparoscopy may also be used to find the cause of female infertility. During this procedure, a small cut is made in the lower abdomen. A thin, lighted tube is inserted into the cut to view the inside of the abdomen. This test looks for signs of disease or scarring. Finding the cause of infertility can be a long and emotional process. It may take time to complete all the needed tests. You shouldn't worry if the problem is not found right away. Treatment. Treatments for female infertility may include medicines, surgery, or assisted reproductive technologies. Many times these treatments are combined. Infertility is treated with medicines or surgery in most cases. Healthcare providers may recommend specific treatments for infertility based on test results, how long the couple has been trying to get pregnant, the age of the man and woman, the overall health of the partners, preference of the partners. There are a number of medicines available to treat women with ovulation problems. It is important to talk to your healthcare provider about the pros and cons of these medicines. Many fertility drugs increase a woman's chance of having twins, triplets, or other multiples. This may cause more problems for both the mother and her babies. You should understand the possible dangers, benefits, and side effects of these medicines before starting them. Intrauterine insemination is another possible treatment for infertility. It is often called artificial insemination. In this procedure, the woman is injected with specially prepared sperm. Intrauterine insemination is often used to treat couples with unexplained infertility, some male infertility issues that can affect the sperm, women who have problems with their cervical mucus. Another treatment for infertility is assisted reproductive technology. Assisted reproductive technology is a group of different methods used to help infertile couples. Assisted reproductive technology works by removing eggs from a woman's body. The eggs are then mixed with sperm to make embryos. The embryos are then put back in the woman's body. There are different methods of assisted reproductive technology. The most effective method is in vitro fertilization. It is often used when a woman's fallopian tubes are blocked or when a man produces too few sperm.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Infertility is a term healthcare providers use if a woman is unable to get or stay pregnant. After treatment for infertility, 2/3 of couples are then able to have children. There are many possible causes for female infertility. It can be caused by physical problems, hormone problems, and lifestyle or environmental factors. Most cases of infertility in women are caused by problems with ovulation. Without ovulation, there are no eggs to be fertilized. Irregular menstrual periods may be a sign that a woman is not ovulating normally. Age may affect a woman's ability to have a baby. About 1/3 of women over 35 have fertility problems. Some other risk factors include athletic training, being overweight or underweight, alcohol abuse, health problems that cause hormonal changes such as PCOS and POI, sexually transmitted infections, smoking. Some health problems increase the risk of infertility. Women should talk to their healthcare provider if they have endometriosis, irregular periods or no menstrual periods, more than one miscarriage, pelvic inflammatory disease, painful periods. It is a good idea for women to talk to a healthcare provider before trying to get pregnant. He or she can help you get your body ready for a healthy baby and can also answer questions about fertility and give tips for conceiving. Treatments for female infertility may include medicines, surgery, or assisted reproductive technologies. Many times these treatments are combined. Infertility is treated with medicines or surgery in most cases. Healthcare providers may recommend specific treatments for infertility based on test results, how long the couple has been trying to get pregnant, the age of the man and woman, the overall health of the partners, preference of the partners. Thank you for using Explain.